when somebody's screaming and yelling and protesting and blaming, that if you really, really listen, underneath all the surface anger is a desperation. And what is that desperation? The desperation is, are you there for me? Are you there for me? Do I matter to you? Will you respond to me?
Okay, Sue, welcome to the show.
You're welcome. I'm glad to be here.
To get started, in your book, Hold Me Tight, you talk about a conversation that you were having in the pub with a friend. Actually, it was an argument. And in this conversation, you were talking about the paradigm of relationships as bargains. And you had an insight during this conversation that completely changed I think, your trajectory in your therapeutic work. So can you tell us about this insight and why this was so significant for you?
Sure. When I first started in couple therapy, really the only two shows in town were the analytic view, which was simply that we project out onto our partner whatever is going on with us, and it's really our personal problem, right? And the other one was a cognitive behavioral view, which is that it's all about communication, and you've got to teach people communication skills so that they can bargain for what they want. They can negotiate more effectively for what they want. And the theory was that you could negotiate for anything, really. You could negotiate for each person being able to have affairs and not telling the other partner. You can negotiate for anything because relationships are a rational bargain. Well, neither of those things helped me at all when I saw my distressed couples. And neither of those things seemed to resonate with them either. It was like I wasn't getting anywhere. So I just put EFT together from looking at tapes of working with couples and seeing what worked and doing more of it, basically. Not really rocket science. The point was the results were stunning for that first study. I was totally shocked, but I didn't know really why why we got those results. I didn't want to say, I don't know why we got them. I didn't say that in the outcome study. I just said, oh, we got these amazing results. But in that conversation, I had just listened to a cognitive behaviorist saying that bonds were bargains, that the relationship between couples were bargains, and therefore you taught people negotiation skills. Well, I knew that didn't work. I knew it didn't work, right? So I was sitting there and my colleague said, well, what's wrong with that point of view? Why aren't they bargains? Why can't you rationally, why can't you teach people how to be more rational, and then they'll stop being so mean to each other? And that's not how it works. Everyone who's been in a relationship knows that's not how it works. I've been doing this for years, and I know that when I'm in a big fight with my incredibly strong-willed husband, that there's a voice in my head that says things like, don't say that, it's amazingly unskilled, and it's bad communication, and it won't get you anywhere. And then I say it, and everyone knows what I'm talking about, because the emotion gets so strong. You don't want to be reasonable and make a bargain. You want to prove the other person's wrong. You want to get back at them. You want to not feel so vulnerable. So I knew that was wrong, but I didn't really have an alternative. And then in that conversation, I said, out of the blue, don't be crazy. Love relationships aren't bargains. They're bonds. They're emotional bonds. The point was, as I said that, I'd read Bowlby, and it was all about mothers and children. And the theory back then was that you became an adult around 12 and you became independent, and strength was about being separate, not about being connected, right? And so, I had that in my head. But when I said that out into the world, suddenly all of Bowlby's work kind of came rushing into my head. And I thought, oh my God, these relationships are emotional attachment bonds. And the reason we got the results we did was we helped the couples have real bonding conversations. Oh my God. So then suddenly everything went, came into place. However, it was amazingly unpopular point of view. I, everybody was into no. Adulthood was about leaving bonds and becoming differentiated, individuated, separate. Right? If you maintain these bonds, you were somehow codependent. All these terrible words for dependency, implying that it was always negative in adults. We were all supposed to be self-sufficient. I say things like the only self-sufficient adult is a dead adult. We're not wired for it. We're fish in a sea of attachment relationships. And if you take fish out of the sea, they start to look very weird indeed. So, but I started writing articles about it, and my goodness me, not only would they get refused, they'd get, 6 pages of single-spaced diatribe about how I was dangerous and should be stopped and shouldn't be listened to. And oh goodness me, it was like, obviously I was touching a nerve somewhere. I remember once giving a talk and 5 people getting up and all leaving, and then coming and telling me afterwards that I didn't understand dependency, and it was something that people had to get over. They had to get over it. Whereas, of course, Bowlby says it goes from the cradle to the grave. It's who we are. We are social, bonding animals. It's wired into your nervous system. It's not something that you get to choose or not choose. You can spend your whole life trying to wipe it out if you like. And some people have very good reasons for trying to do that, but which we acknowledge in therapy and work with. But that's who we are. And this theory, this science, is the only science in psychology for me. It's a developmental theory of personality, and it basically tells us who we are. So for a therapist, for a functioning therapist, it gives me a map to what I'm dealing with and who this being is in front of me, and how I can tune into their world. So that's what happened. But it's very ironic that it would happen in a bar, because I grew up in a pub in England. So it's kind of ironic. It's sort of weird, but it did. That's where it happened. And yes, it had an amazing impact. It gave my clinical work more direction, more focus. It helped me understand people on a different level. If you really don't have a theory of people and who we're dealing with and who we are, and what really matters to people, what their deepest longings and needs are, I think you're stuck with interventions, doing various interventions without having a real context of how these interventions would fit into how somebody shapes who they are, how they see themselves, how they engage with others. I think if you're going to be a powerful therapist who's on target, you need to have an understanding, a basic, clear, broad understanding of who we are as human beings and what drives us, what matters most. Bowlby was hated because he basically he said taboo things. Like he said, Freud is wrong. Aggression and sexuality are not the most powerful drivers of human beings. The need for connection with other people and to belong with other people is the most powerful driver of human beings. So, to say that he was unpopular, and I seem to have a knack all through my career of joining the outsiders, the unpopular people, but it's all right, because I'm proud of where we are in emotionally focused therapy right now. So that was the insight.
I've interviewed a few different people that have developed um approaches to psychotherapy, like their own approaches. And the common trait they all seem to share is that they are able to take risks and stick their neck out. And almost always at the start, they take so much flack for it, but they've something in them that's able to persevere through that, But I wanted to ask you, about, it seems that we live in a society that is not conducive to healthy attachment. It doesn't foster healthy attachment relationships. It seems to almost push us in another direction. And I wanted to get your thoughts on maybe the root causes of that. Like what's kind of driving our we're not we don't live in a society that is aligned with who we really are as people, you know?
I think you're right. And I think it's upsetting. Well, it's upsetting to me anyway, because it's like believing that that there's a road through the what does James Taylor call it? There's a pathway through the darkness and the mist. You feel like there's a pathway, and everyone else is saying, no, we're going down here. No, we're going to constant distraction. We're going to, our phones. We don't want to have conversations anymore at all. We're going to our phones. We're going to, just basically constant movement, not staying quiet and still and looking into somebody's eyes. It's like we're not even teaching our kids to do that anymore. I think I wrote something for social media yesterday where I talked about that the new French president, I can't remember his name, Macron just made him president. I think they call him president, has brought in education bill where he insists that kids are taught empathy. I thought, oh my goodness, kids are taught empathy. What? Like, yeah, like we're teaching kids communication skills on the computer. Why not think about teaching them how to do face-to-face empathy? And we're teaching them to be anti-racist. We're teaching all these good things to be anti. But the core of the matter is, if we taught them empathy, those other things, which are often a symptom of lack of empathy, would be impacted. But we don't seem to see it that way. We still don't really value relationships. It feels like, the relationships are a contract idea is that it's about control and it's about making deals, and so I think you're right. Our society doesn't teach people to invest in relationships. It doesn't. It teaches us to work more and more. I remember being told that once computers got going, everyone was going to only work 3 days a week. That's not what's happening. That's definitely not what's happening. Couples tell me, oh, well, we don't have time, to talk, to be together. I say, oh, really, what do you do? Oh, well, the kids are all in things after school. We have thousands of things for them to do. I have to do my emails. I get up and I'm on Zoom. My husband is on Zoom. Like I wake up, what is he doing? I can hear him. He's on Zoom. So no, we've gone another route, and the consequences are obvious, and they're here with us. Loneliness is now a huge issue in our Western societies. They've even got a minister of loneliness, I think, in the UK. Fascinates me. I don't know. I should write and ask him what he's doing. But there are things we could do. Like we could consider teaching kids about relationships and empathy. We feel the need to teach them about all these sort of woke ideas. We must teach them about gender. We must teach them about. What about teaching them about relationships and empathy? And there's lots of things we could do, but we don't prioritize relationships. We still don't understand that in the end, the human nervous system is designed to know that you belong to somebody, that you matter to somebody, and that they have your back. And when a human being knows that, they can function on a totally different level than when they feel that they are alone in the world. And that isolate, the main message of Bowlby, the main message is that isolation, emotional isolation, is iatrogenic, it's poisonous, it's toxic. And human beings aren't designed to cope with it. Sometimes some of us can, but we pay a huge price. It's clear that the more alone you are in the world, the more likely you are to become chronically depressed, anxious, have PTSD. It's clear. It's a secure attachment is a precursor to resilience and emotional and mental health and good relationships. Insecure attachment, emotional isolation is the precursor to every mental health problem that we've ever identified. But we still don't go there. We still don't go to the heart of the matter and say, this is about emotional isolation. People aren't designed for emotional isolation. Why are we building tiny little boxes all over our cities for people to live in by themselves when we know that doesn't work? Why do older people say one of the huge problems is that they're alone? They don't. I think what we don't understand is that strength comes from belonging, not from knowing you belong, and not from separateness and being able to say you don't need people. We always say belonging leads to becoming. When we work with our couples, we see that when the relationship improves, the couples change as individuals. They become stronger, clearer, more confident, more clear about who they are. They can get their needs met. They can turn to this other person for support. They grow, which is what Bowlby said. Bowlby said, human beings grow with each other, not in this glorious isolation. We have all these movies like Rambo, they're sort of fun, but they're naughty too, because they give us this image that, a strong man is, somebody who takes on a whole army by himself. Well, no, that's not true. And anyone who's worked with war vets, and I've worked with a fair number, we work with a fair number, that's not true. Why do men go into battle in the end? For their country? No, not really. For some noble view of themselves? No, not really. They go into battle for the buddy standing beside them. They go, the motto for the US Marine Corps isn't kill the enemy. It's a Marine never leaves another Marine. They go in and they fight with their buddies for their buddies. And, there's a bond between fighting men. Of course there is. They face death together. And that they face, I grew up in England after the war, not right after the war, but the war was still somehow present in the air. And what I knew when I grew up was that everybody needed each other. That was in the water. That was in the culture. That was in everybody needed each other, and so that whole society was kind of organized around that. People would stop and talk to old people on the street. People would, if somebody needed help, people would go in and try to help people. It was just that feeling that if we're going to make it through the hugeness of life, through our joint vulnerability, because we are vulnerable, if we're going to make it, we make it together, and that was still there. Now I feel like I think we've lost it, and in our society today, it feels like people are becoming more and more polarized and more, it feels like what we want to do is criticize each other and tell the other person they're wrong, or that they're not they don't have the right ideas, or whatever they are on whatever topic, and we're the people who are right. And in the end, right is the booby prize. It just leaves you alone in a room screaming how right you are. Civilization isn't about finding out what's right. It's about being able to come together with other people. So I'm ranting on here. You must stop me, okay? But your questions are interesting.
Um, no, that was a great answer. And just a comment, it seems that as individuals, we all have a value structure, and as societies we do too. And it seems that as a society, our value structure is way out of line, and we've got the wrong things at the top, and the things like attachment and relationships are too far down, and that needs to be addressed. So something I found really interesting about your book, so was whenever you're working with couples, and I might be wrong here, so I'm gonna say, and then correct me if I am, but whenever you're working with couples, one of the things you do is that you take the focus off the individual as being the source of the problem in the relationship. And what you do is through the EFT lens, you view the pattern of relating, or the dance between the couple, as the variable that needs to be changed. Can you tell me about this, and why this is so important, and why this is so helpful, this lens?
Yes. Well, because couples and countries and people in society get stuck in mutual blame, in a sense that they're separate from other people and the other people have to change, and they get stuck there. Whereas a more useful frame is to step back and say, what is the dance we are doing together, and how does it keep us stuck? And to do that, you do have to be able to step back and take a meta perspective, and I mean, watching thousands of tapes of couples taught me that, because I saw pattern. Science in the end is the identification of pattern, and then the explanation of that pattern. And I just saw all these patterns, and I saw that they were all about bonding, or the lack of bonding. That when somebody's screaming and yelling and protesting and blaming, that if you really, really listen, underneath all the surface anger is a desperation. And what is that desperation? The desperation is, are you there for me? Are you there for me? Do I matter to you? Will you respond to me? And, this is the $1,000, $1,000,000 question in all relationships. Are you there for me when it really matters? Do you see me when I'm vulnerable? Do you care? And of course, people don't ask that question directly, because we don't want to be vulnerable. We think it's a weakness, right? It's a given for human beings. So strength is how you deal with it, not denying it. But, so people don't say, I'm feeling, if they do, they don't come to your office. They say, I'm feeling lonely these days. You seem to be so caught up in doing your Zooms. My family could say that to me. Here I am doing a Zoom. And I'm feeling sort of lonely, and I'm kind of feeling sort of like I'm abandoned here, which is a bit crazy, but that's how I feel. People don't do that. They say, why don't you ever talk to me? And of course, what happens is the other person, who's also a very sensitive, bonding human being, hears rejection, hears, you're doing it wrong, you're disappointing me. And the other person gets defensive about that and says, we had a talk yesterday, and what you're talking about, you're always so critical. And then they're off, right? They're trying to prove that one person's critical, and one person's unreasonable, and they're off. And the real conversation, which is, I'm so sensitive to your criticism, I get so overwhelmed when I hear that I'm disappointing you, and that I hear that I'm somehow not who you want me to be. I get so overwhelmed that I just freeze up and I don't know what to say. So I just try to shut down. And of course, when we shut down in a relationship, we shut the other person out. And then the other person feels abandoned and alone, and they get more and more freaked out. So, there are positive ways of handling this dance, but you have to recognize the dance. You have to recognize we're relational beings and we create certain dances with other people. And these dances can be healthy, loving dances where we grow each other and we help each other deal with how overwhelming life is, which it is for all of us. The only way you can not really experience that is to totally shut down and numb out, and people do that. I mean, I do a lot of individual therapy these days, emotionally focused individual therapy, EFIT. And, that's because we work with so many trauma survivors as individuals, not just as couples. And so we decided to sort of really say what we are doing there. But one of the last people I saw, she was classic. She said, I don't want to talk about my emotions. I don't want to be vulnerable. I certainly don't want to be vulnerable with my partner, who I know loves me, but I don't want to be vulnerable. I said, I understand. And then she looks at me and says, and I can't live shut down and numbed out and alone anymore. And I say, yes, I understand. And she's in a pickle, isn't she? Because either way, she deals with her emotions, and that's what it's all about. And that's one of the things that Bowlby said that made him unpopular too. He said, it's all about emotion. It's all about dealing with difficult emotions. And we still don't want to deal with that in psychotherapy. Sometimes I think we'd almost do anything but deal with that. We'll talk about people's negative cognitions. We'll talk about their feeling in their shoulder. We'll talk about their past. We'll talk about their dreams. We'll talk about anything except what they're feeling right now, because we haven't really taught therapists what to do with that one. So, and the couple don't know either. So they have this conversation that's about reactivity. I get angry with you because I feel more powerful when I'm angry than if I say, hey, I'm feeling lonely and small here. It's easier for me to say, where the hell have you been? I thought we were going to go out on a date. That's easier than to say, I was sitting here in the dark in the kitchen thinking that our date wasn't important to you, and that made me feel really awful. That's harder for most people to say than, where the hell have you been? Right? And it's easier to say, oh, there you go again. We haven't even gone on the date and you're criticizing me. I don't want to go on the date anyway. That makes me feel stronger than saying, oh, you're mad at me and that feels awful. And I was looking forward to connecting with you. And now I don't know what to do. And it feels like I always do everything wrong. And I'm just freezing up here. We don't know how to have those emotional conversations. So the first thing we do in EFT is show people that they're caught in this dance, and it's a bonding dance, and that basically they freak each other out. Nobody can freak you out like the person you love. I mean, we know that. I'm a pretty strong person, but my husband, who I've been married to for 35 years, 36 actually, there's a certain tone of voice he can use. I can't quite capture it right now, but he's the only person on earth who calls me Susan Maureen. And when he calls me that, my whole nervous system goes zing, like, oh, I've blown it here. What have I done? What have I done? I've blown it. And we have a great relationship, but there's still his voice can trigger. Of course, it can trigger alarm in me. That because when people are terribly important to us, those are the people that can comfort us and bring us down and give us emotional balance. And if they're also the people that can freak us out, if we find them unavailable or we get that we're blowing it with them. So what we do is we show people that it's the dance they're caught in that's the problem. And that's something they can change. Whereas, in relationships, they try to change the other person with ways that don't work. You know, well, if you're mean to me, I'll shut you out. Well, that doesn't work because you just get madder. And well, you know, I'll nag you until you do what I want. And then people say, you're only doing that for me to stop nagging you. You know, it's like, in other words, I don't trust you anyway. No matter what you do, I don't trust you anyway, because we haven't had this emotional connection. So the first thing we do is we show people the dance they're caught in, and that it's all about bonding. And it's all about not feeling like you belong. We need to belong. You can see that out in the world these days. It's like everybody suddenly needs a group to belong to. You know, I just can't be Sue Johnson now. I have to be cisgender. I have to be this and that. I'm either a transphobic or I'm pro-trans. I have to be, you know, I mean, all these, we're obsessed with putting people in groups and group identities. We've forgotten people are individuals. That's the essence of what liberalism talks about. It talks about that you're an individual and you're not identified by your group. You know, people say, well, do you use pronouns? And I say, no, not really, because they change all the time and the list gets longer. And I forget in the middle of therapy, you know, when I'm thinking about another 1,000 things, I forget. And they say, what do you do then? I say, I use people's names. That's what I've always done. That's what I did when I was a child in working class England. You used somebody's name. I remember everybody's name from when I was a child. Auntie Nellie, who was the cleaning lady who had one tooth in the middle of her mouth, right? And a great big tummy with a very dirty apron on it all the time. I remember her. She was an Auntie Nellie. You know, she wasn't a she, her, whatever. She was just Auntie Nellie. And so, yeah, we show people the dance they're caught in. And it's the dance that keeps them stuck. And it's all about emotion. Emotion organizes your inner world and your relationship dance. And it's all about the emotional messages you send, which people do not understand the messages they send, and they don't understand the impact of those messages. You know, and I think it turns up in our mothering. If I sit in one more airport and watch a mother who I'm sure is trying her best to be a good mother, and her child is complaining in a little car, in a little seat, and the mother is looking at her phone and saying, what's wrong with you? You're just fine. You're just fine. And the child is wanting her attention. The child is saying, where are you? Where are you? And the mother isn't hearing it. The mother is off on her phone, you know, and the mother says, oh, here, have a bottle. And you see the child zone out, which is what Bowlby talked about. He looked at mothers and infants, hundreds and hundreds of them, and found these patterns. And we think the child goes quiet and feels okay. I think mostly what the child does is zone out. And you watch them, you watch their face. You can literally see it in a child, okay? Because children don't put facades on, right? They're just who they are. You can see them shut down. I remember watching this little kid. He shut down. He left his bottle in where she put it. And he just shut down and went still. And his face got glazed. And his mother said something like, there's a good boy. Well, that child just learned, I won't be responded to. And the only way to deal with this emotion, this difficult, you know, obviously unacceptable emotion, is to zone out. And if that child learns that lesson 10 times a day for the first 3 years of his life, that's what that child will do with strong emotion until he learns something different. And love relationships are our chance to grow in a whole new way and to learn how to deal with our vulnerability in a way that creates a strong connection with self makes us confident that we can deal with emotions, and a strong connection with other people, which makes us, makes us stronger.
For sure, for sure. Something I think that's important to cover here as well is that there's a really strong evidence base for this as well. You're getting incredible results from this therapy. Can you tell us a little bit about that there, just so people have an idea?
Well, we have got incredible results. We've got, I don't know how many, tell you the truth, it changes day by day. We've got like, oh, over 30 studies, outcome studies, positive outcome studies. What impresses me the most, tell you the truth, is we've got good follow-up studies, which when you think about a therapy that looks at a distressed relationship, where the people are often also depressed and anxious, because that's what distressed relationships do. They make you depressed and anxious, okay? Or that somebody's suffering from PTSD, which we often see. We deal with a lot of trauma in couples and in individuals. When you look at that and you're changing a relationship dance, and you're starting to change the people, the idea that you can work with these people for 10 to 20 sessions and that you can still see the positive results on them and on their relationship 3 years later is, when we first did we didn't do it, the hospital did it. We did our first follow-up study. I remember not wanting to look at it. I remember closing my eyes and sort of looking at it sort of sideways, like with a cup of coffee in my hand, like, oh, I know we do good stuff, but we're never going to find this in research. Well, we did, and we do. And why is that? That's because the changes we help people make are so positive and powerful that people keep doing them. They keep doing the behaviors that, that once you show people how to create a safe bond, then they know how to do it. It's the most stimulating thing in the world. It's what turns human beings on. It's like, okay, like moving in synchrony with another human being isn't just for mothers and children, it's for all people everywhere, which is why people like to dance together, sing together. It's, this bond is so powerful. So we have really good follow-ups, which I believe we're the only couple therapy that can say that. And we've just done a big study on EFIT, individual therapy, and it looks like we're going to get the same kind of results there as well. Not only the relationship improves, depression, anxiety, PTSD in the individual people improves. Of course it does, because they're not facing it alone anymore, and they have someone they can count on. And we even did a brain scan study, which nobody talks about, because by the time I did it with my colleague at the University of Virginia, who's a neuroscientist, and
Is that James Cohn?
yes, Jim Cohn, and even he said that by the time the PLOS One accepted it, it was incomprehensible to human beings. Okay, even I said, Jim, I don't understand a word of this article, and he said, I don't either, really, but this is what you have to do to get a neuroscience article accepted. I said, oh, okay, fine. And I remember saying, well, what does this mean in this scan, where the woman's lying alone in the machine and her partner holds her hand and a stranger holds her hand and she's alone. And at the beginning, before therapy, in all three conditions, she freaks when she thinks she's going to be shocked on her ankles. And in this scan, her brain goes all red and into alarm. And in this scan, after therapy, when a stranger holds her hand and she's alone, her brain goes berserk. But when her partner holds her hand, it stays all calm. You're telling me that this is a picture of that. What do the blue bits mean? And he said, the blue bits, Sue, mean that she's not dead. It's a resting brain, but she's okay. I said, oh, okay, that's what it means. All right, then. Like, it's a difficult study to understand, but I didn't understand why there wasn't more fuss made of it, because for me, it was a revolutionary brain scan study showing that John Bowlby's ideas work and they reflect the truth of who we are as human beings, and that our therapy is changing the way people deal with threat at a very, very basic level. You know, the world is a different place if when a threat comes, you're on your own and you believe you're on your own. And when a threat comes, you know that you can turn to somebody who loves you and say, this is scary and threatening. And they'll say, I'm here with you. I've got you. We'll do this together. Those are different worlds to live in, you know, and your nervous system responds to those worlds totally differently. So that brain scan study for me was enormously fascinating and wild. And I actually foolishly, because it's important to me, I thought it would make the front of the New York Times, but of course it didn't at all. It didn't sort of even get mentioned in the local Post. You know, it was sort of, well, you know, I don't know. People said, oh, it's just, you know, brain scan study of after couples therapy. Who cares about that? But it's all these studies over the years. Attachment science has got thousands and thousands of studies. Until about the beginning of this century, none of them were on adults. They were all about mothers and children. But since the beginning of the century, there's just hundreds and hundreds and hundreds of studies on adult attachment. And it all basically supports Bowlby's basic ideas of who we are, you know. And so for me as a therapist, this grounds me, this gives me a map to who people are, to their basic longings and needs and fears, to the ways of dealing with those, and to the way they get stuck in ways that they lose their secure connection with themselves. They don't even trust that they can process their own emotions or deal with their own feelings. They lose their secure connection with others, and then they're alone in the world. And that induces panic and fear and shutdown and addiction. You know, we if we're really in pain, we look around for an escape. And our world is delighted to give us an escape, which usually makes somebody else money, you know, but our world's delighted to give us thousands of escapes, you know, video games. And you know, I know lots of adolescents who spend most of their time sending repetitive texts to their friends. Well, they're not friends. You know, they're people that they've never met and that wouldn't come when they called. You know, a friend is someone who will come when you call. For me, that's a friend. Anyone else is an acquaintance, you know. But yeah, and now I've forgotten what the question was. What was the question?
It was just around the evidence base for EFT,
Oh,
but no,
right. There's a
that's
huge amount of evidence for all of this. And there's a huge amount of evidence for EFT as a couples therapy. But we also have studies in that body of research that shows that individuals change, that we can change the security of their attachment. Nobody's ever shown that before in couples therapy. Of course we can, because we help them have bonding conversations. The point is having a theory of personality, a developmental relational theory of personality, grounds you, tells you, focuses you as a therapist, gives you a map to what's going on with people and what health looks like, how people get stuck. You know, we know where we're going in EFT. We know, you know, people like Mario Michelanza and Phil Shaver, who've done so much of this research, and John Bowlby himself gave us a clear picture of what health was, what a resilient, strong human being looked like, you know. And so much of our theories go for pathology, you know, what's wrong with this person, and there's 8 theories about what's wrong with this person. Well, what does health look like? Where are you trying to get them in therapy, whatever kind of therapy you're doing, individual or couple? You need to know that. Because if you don't know that, You know, you're not helping people walk through the darkness and the mist. You're lost as they are lots of times. And the key thing about that one is you teach them how to deal with difficult, unacceptable, alien emotions. That's what you teach them. And you teach them how to look at their vulnerability and accept it and deal with it in a way that makes them stronger. That's what you're doing in psychotherapy. It doesn't matter whether you're working with depression, anxiety, PTSD. That's what you're doing in the end. You're teaching somebody how to have emotional balance and how to be able to look at and own their inner needs, their inner fears, and stay with those things and be able to own them and recognize them. And most of the time turn to others. You know, those others that we turn to aren't always even present. You know, if you've had good attachment in your life, you have internalized your attachment figures. I know that I've internalized my English father. I don't know how he learned to be a spectacular parent, but he was a spectacular parent. Okay, this uneducated man who ran away to the Navy, lied about his age, and the only education he ever really got was on a destroyer, right? And but somehow he knew how to deal with a rather strange, bit difficult, oppositional little girl who was working class and who was told when she was pretty young that I could either be a hairdresser or a nurse. What did I want to be? And I said, I'm not doing that, you know, and my relatives all said, oh, she's so difficult. I don't know how you deal with her, Arthur. And my father would just beam. He would just beam. He'd beam. He loved it when I wouldn't, you know, when if somebody said to me, you have to do this, my stance as a little girl was, I'm not doing it. You know, if you ask me, I'll do it, you know, but so, you know, that was, and so I've internalized him. And what he always told me, bless his heart, is that it doesn't matter what comes over the horizon. You're strong. You can deal with it. And I believed him because he was the most important person in the world. And, you know, and he's still there, you know, when difficult or amazingly good situations come up, he's still there. I received the Order of Canada, which in Canada is huge honor. 100 people a year are named to the Order of Canada, and it's for your contribution to the community, the difference your work has made to the community. So I was beyond honored. And when I went up to receive that award, I was totally dissociated. I was out of I was gone. Okay. I was just breathing and putting one foot in front of the other. And I thought, I'm not going to make it. I'm not going to make it up there, you know. And then my father's voice was there, and he said, well done, sweetie. You know, this is good. You deserve this, which I still don't believe, but on some level, on some rational level. But, you know, so then I could breathe and I could walk up and I could do what I was expected to do, which is shake the guy's hand and, you know, act like I was together and have my picture taken. And, you know, so we internalize these attachment figures.
At the time, how real did that feel for you when you were walking up and you heard that voice? How real was that for you in that moment?
It was totally real. It was as real as the carpet underneath my feet, which was red and blue. It was totally, totally real. Unfortunately, we work a lot with people for whom those internalizations of our attachment figures are negative. You know, we work with people who, you know, they're chronically depressed and they've been on medication for 20 years and now they don't want to live their life completely numb. And when you talk to them about how they know who they are, these images and particular incidents with their mother come up, you know, and basically what you get was the message from the mum was, I don't want your softness, your vulnerability. I don't want your emotions. You just please me and do what I say, and maybe I'll respond to you. And this script has really determined so much of this woman's life. You know, the sad thing is that she recognizes that her husband loves her and wants to be close, and she can't let him in. She can't trust him. What is that about? It's about the fact she still has this in her head and in her nervous system, you know, which is that if I let you see who I am, you will turn away from me. You will shut down. I will be judged as not good enough. So I never let you see who I am. I never let you in. And so I never find out. I never feel really loved. I can say my husband loves me. I know my husband loves me. But look at my face. I mean, it's a sort of cognitive idea. I don't feel it in my body, you know, because she never really risks with him or lets him in, you know. So it's these attachment experiences we have as children teach us who we are and teach us how to engage with other people. And if it's negative, sometimes we have a hard time revising that. You know, it's like, who was it who said, was it a philosopher or a poet? You can't be a self all by yourself. You can't be a person all by yourself. You're always defining who you are in relation to other people. And, you know, if when you grew up, you experienced other people as profoundly abandoning and rejecting, then you don't have much room to move as a child. You don't have many ways to deal with that. You really only have two. You have ramping up the emotion, getting angry and oppositional and annoying. I think that's what I did because of my relationship with my mother. Or shutting down and becoming compliant and numbing out, you know, and shutting your needs down and other people's needs down. So that's about it. I mean, as human beings, our emotional repertoire isn't actually terribly huge. In fact, emotions are quite simple. And what we try to do in EFT is tune into them and befriend them and show people where they're caught in the negative ones and help them walk through them to the other side. And people will do that. If you give them a sense of safety, they will do that. And so it's a lot about creating that safety in therapy.
For sure. Now, just a couple of questions to wrap up here, Sue. The first is with EFIT, so emotion focused individual therapy. Why do you think this is so effective, and what distinguishes it from other forms of psychotherapy? Like, what's the main differentiating factors here?
Well, I think it's the same as EFT for couples. It's the way we deal with emotion, and it's our perspective. You know, we have very clear ways of dealing with emotion. We know how to help people assemble their emotion, put it together in a way that makes sense so that they can start to get their balance with their emotions. You know, lots of the time when people are shut down, we talk about, when we really listen to them, they're talking about feeling overwhelmed. You know, when you give people those kinds of words, you know, it's like they start to make sense of their emotion. And when you give them specific ways of seeing the emotion calms down. There's a woman called Barrett Leonard, I think I've got her name right, who does research on emotion, and who points out that the more specific you can get with emotion, the better you are at handling it. You know, people say, I'm uncomfortable, and what we try to do is help them get more specific. Could you help me uncomfortable? Where do you feel that in your body? I don't know. I'm just uncomfortable. Right, I understand. So your partner said this to you. You give them the trigger, right? What triggered them? And so, or you said this. You talked about your mother saying this to you, right? And this comes up in your mind a lot. And, you know, where do you feel this? Well, I guess I feel it in my chest. Oh, What do you feel in your chest right now as you talk about it? I feel shaky. Oh, okay. And what do you tell yourself when you get shaky like this? I tell myself, don't be ridiculous. Just shut this down and stop it and go into your fog. You know your fog. You're better off staying in the fog. Just shut down these emotions and go into the fog. Oh, okay. So you shut you down and you shut other people out. Yes. Right. And then I know what happens because I'm an attachment-oriented therapist. What happens is the numbing out feels all right for a while, and then it starts to feel bad too. And then the whole thing happens again, the trigger, and this, this continues, right? So this is the person telling me how they put their emotions together. And they start to understand that they're caught in this wheel like a rat in a maze. Right. So we have particular ways of dealing with emotion and going for core emotion. Lots of times when we work with trauma, I always used to think that the core emotion in trauma was almost always got to be fear. And more, as we're working with more and more trauma folks in individual therapy, we are finding that when you really go into most traumas, the core emotion at bottom is terrible grief and loss and sadness. But what was lost and what cannot be grieved, because the grief feels so overwhelming. You're going to die, you're going to go crazy, the pain's going to go on forever. It's grief and sadness, right? And so that's fascinating. So we have a particular way of working with emotion. We go straight into the emotion, we track it, we follow it, we trust it, we listen to it in a way that I don't know. We're not trying to create insight. We're not trying to, and we have a particular way of deliberately creating change events. We have, and all this is framed. We know where we're going because we're listening to attachment science. So we have a direction, we have a focus, we're on target, and we know how to create these change events where couples can turn and share their heart, their softer feelings with each other in a way that pulls the other person close, and that changes how they see themselves and how they see their partner. Or in individual therapy, a person can suddenly remember what they couldn't remember before. And I write about this in the last book I wrote, which is called A Primer for Emotionally Focused Individual Therapy. It came out a couple of years ago with my colleague, Leanne Campbell. It's basically what happens is a woman remembers her first being raped by her father. She couldn't bear to remember that before, and she remembers. But this time, she can actually see the little child that she was lying on the bathroom floor, weeping. And this time, her strong, resilient self that we've built in therapy over about 25 sessions, right? This time, she is not just that little vulnerable child lying on the floor, freaking out. She has a strong, resilient self. And so we do an imaginal, what we call, you create an identity drama where, she can go into that scene, and she, as the adult, she can see herself bending down and holding that child and helping that child with her vulnerability and reassuring that child and saying things like, I'm here now, there's a way out, we can survive, you can come with me, I'm here now. And it's fascinating to us. Psychotherapy is fascinating. Growing people is fascinating. That's what we're doing. We're not just trying to help people with symptoms. That's the booby prize as far as I'm concerned. Growing people is the most fascinating thing in the world. And I think it will always be some kind of mystery, for me anyway. But it still blows my mind when a client goes through this, and then in the next session you say, I'm so concerned for you. There was so much pain last time. You see, we evoke the pain, but we hold them in the pain, which is what a good attachment figure does, so they can tolerate it, right? So, and this lady laughs at me and says, "Oh, I'm fine." So how can you be fine? After you access this terrible memory. And she says, "I am fine because I have me. I have me now." The adult me could go in and hold that little vulnerable part of me and recognize how terrified I was and recognize what happened, and could go in and comfort me and hold me and accept what happened and know that I'm bigger than that. I said, "Oh, wow. Okay. Yes. Oh." And this is how I still feel when people do these incredible changes. So we know how to create these change events. And we know, because we've shown it in our research, that these change events, these emotional epiphanies, whatever you want to call them, corrective emotional experiences, we know, because we've shown it in 10, 11 outcome studies, that these events, these emotional events, when you code them on a piece of tape, we know that they predict good outcome in therapy, good follow-up, more secure sense of connection with self, because we want a secure sense of connection with self in the individual therapy, and with others, and we know that this leads to change. So we're very focused. We know where we're going. We know what health looks like. We know we're using attachment as a frame and a pathway and a focus. So that makes us different. The way we deal with emotion makes us different. How relational we see human beings makes us different. And I think the quality of our connection with our client makes us different, because we're sort of Rogers on amphetamines. We're sort of Rogers. Somebody said to me, "Would Rogers like you?" And I said, "I don't know, because Rogers would would reflect, beautifully once every 20 minutes. And I teach my students, reflect constantly, constantly reflect. Reflect the emotional core of what your client is saying to you. Reflect it, hold it with empathy and acceptance, and reflect it back all the time to this person, because they're caught in a different kind of reality. So and as you do that, you help them process that and deal with it in a different way. You help them relate to their emotions in a different way, as something that they're not overwhelmed by, right? And as something that can be listened to and that gives a direction. So so I think we're pretty different than most of the therapies out there. It feels to me like our society and our profession is still phobic of strong emotion. People still say, "Oh, this must be about catharsis." I say, no, catharsis comes from the Greek word for diarrhea. It's not at all about that. It's about going into your emotion and dealing with it in a different way that leaves you stronger. So I think we're pretty different, which doesn't make me feel very good, actually, because if we're to grow as a field in psychotherapy, I think we need to come together and to decide what are the core things we have to deal with in therapy. What are the core issues? What are the real dramas that are going on underneath all these symptom dramas, like depression and anxiety? The point is, depression and anxiety aren't separate. They hardly ever happen. But they happen together, okay? They're not separate. So why do we keep chopping things into compartments? Doesn't help. So yeah, I think we're pretty different than most models out there. We stay with emotion. We trust the emotion. We follow it. We track it. We use it to create change.
For sure, for sure. Okay, well, so it's been an absolute delight speaking with you today. I've enjoyed every minute of this. So thank you so much for sharing some of your wisdom with us. It would be fair to say that you have cracked the code of love, which is no small achievement, you know? So for anybody listening to this and they want to learn more about EFT and your work and they want to like maybe do some training or anything after, where would you send them after this conversation?
Oh, well, I'd send them to my website, drsuejohnson.com, which is mostly for the public, but you know, it's still relevant. I have social media stuff going out all the time, which always comes from an attachment point of view. I'd send them to our professional organization, ICEFT, the International Center for Excellence in Emotionally Focused Therapy, www.iceeft.com. People can find courses, they can find books, they can find pages and pages of studies and articles. And when I look at it, I just can't believe where all this stuff came from. They can find all kinds of things to read and events and YouTube things. There's a lot of me on YouTube. I can't believe it. I looked the other day and I can't believe all the bits of me on YouTube. Some of them I don't like because I look a bit like the Queen, which I really don't like. But you know, they can go to these places and find resources. We teach therapists all over the world. We have over 90 affiliated EFT centers all over the world to help therapists grow and help other people in places like Australia, Iran, Egypt, Finland, England, Mexico, everywhere you can imagine. Because as Bowlby said, in the end, you know, as we're all bonding human beings, we're more the same than we are different. And so people come to us from every country and every culture and every race and every religion in the world, and they say, will you train us? And we never say no. So we're in all these places. So, and we do a huge amount of trainings, and the Hold Me Tight for the public, that book is still strong out there. And we have a Hold Me Tight program online, www.holdmetightonline, that people can go and do an educational program, that people can get programs in their community. There's one we put together with the hospital in Ottawa called Healing Hearts Together for folks, couples who are dealing with one person having had a heart attack, for example. We have a huge grant to look at that intervention. And it sounds arrogant, but I know the results already. Okay, I know what they're going to be. Okay, they're going to be that the relationships improve, and when the relationships improve, the patient improves because the patient takes their meds, goes to the gym, listens to the doctor, is calm most of the time, right? It's not rocket science to realize that this makes another heart attack less likely. It's pretty obvious. This is all pretty obvious. If you see human beings, all the things I've said today are pretty obvious and simple, actually. If you see things, if you put your attachment glasses on and see things from that point of view, it's pretty obvious stuff. So yes, I encourage people to use these resources. You can start with Hold Me Tight because it's an easy way in to what I do. It's focused on couples. We work with families and individuals as well, but it's an easy way in. It was the hardest book I ever wrote, so I'm glad that people like it, you know.
For sure, for sure. Well, it's an easy start into this path. So Sue, thank you so much. I'll let you go. Take care, and
Yes, thank you too. I've enjoyed every moment with you. It's been fun. Thank you. Okay, take care. Okay, bye.
thanks, Sue.